Welcome to Saving Lives in New Jersey, the COVID-19 Vaccine and You, a video podcast presented by the New Jersey Department of Health. I'm Meg Fisher. I'm a Pediatric Infectious Disease Consultant and a special advisor to the Commissioner of Health. And with me today is a very good friend and colleague of mine, Pat Whitley-Williams. Now, Dr. Williams is involved in a variety of different organizations, from the National Foundation for Infectious Disease to the National Medical Association, and she serves on the Advisory Committee of Immunization Practices, which is a branch of the Centers for Disease Control and Prevention. So she's been involved in lots of these things, and I'm going to let her introduce herself and tell you a little bit of how she's been involved with this pandemic.
Thank you so much, Dr. Fisher. It's a pleasure for me to be here speaking with you about one of my favorite topics, immunizations. So yes, I'm presently Professor of Pediatrics at Rutgers, Robert Wood Johnson Medical School, and I'm also Chief of the Division of Pediatric Infectious Diseases at the medical school. I'm also president of the National Foundation for Infectious Diseases, and one of our primary goals is to make sure we educate not only the public, but also healthcare professionals about the importance of vaccinations. And I'm just delighted to be here to talk about COVID-19 vaccines. So thank you for having me.
Thanks. So let's get right to it. Why is it important that people who are 65 and older, like myself, why should we get vaccinated?
It is important that we get vaccinated because I'm also in that same age group. It's very important because if we look at 500,000 deaths, about 80% of those deaths have occurred in people who are older, 65 years of age and older. And we also have evidence that 65 years of age and older, that we have more severe disease if we become infected with COVID-19 virus. So it is so important for people in our age group to become vaccinated.
Now, lots of people in our age group have lots of other problems. Many of them are taking medicines. Many of them are receiving a lot of care from a variety of different doctors. Is it important that they talk to their doctors before they get vaccinated?
Absolutely, Meg. It is so important for patients to go and speak with or by telephone to speak with their primary care provider, particularly if they are on medications already. And just to review, indeed, if they are eligible for vaccination with the COVID-19 vaccine, particularly considering underlying conditions or the medications that they may be taking.
Excellent. And would any of those medicines really be a reason not to get the vaccine?
So you raise a wonderful point. So some patients are on what we would call immunosuppressives, and steroids would be an example of that. Now, it might not cause any harm in terms of the vaccine to the patient. However, it would suppress or blunt or diminish, decrease the response, the body's response, the immune response to the vaccination. So that would be important to know. Also, if patients, they should not take anti-inflammatories because that prior to vaccination, because that may also blunt the response. So it is important to have this discussion with your primary care provider prior to vaccination.
And I suppose in some cases, maybe you would even change or you might, the timing might matter. So you might time the vaccine depending on when you're going to be through with your steroids or whichever medicine might be involved.
Absolutely. Good point. And yes, and if you're expected to stop steroids, but maybe you're on a tapering dose, so it might be a week or two, you may want to hold off getting vaccinated until you're completed that treatment. But again, it depends. You don't want to wait too long, right? Because we know we're a vulnerable age group.
Absolutely. How about side effects? Should we be worried about side effects? What are they?
Certainly. Well, the side effects are not so bad. And I can speak from personal experience. I had 2 doses of the COVID-19 vaccine, and I experienced what they call just a localized reaction. So that means at the site where the immunization is placed in the upper arm, you might experience some pain, soreness, tenderness. It might feel a little bit warm. Or there may be a little bit swelling or redness. And in that case, you want to maybe apply a cool pack, or in that case, after you've been vaccinated, you certainly could take Tylenol or Advil or ibuprofen. That would be perfectly acceptable. Now, some people do have other side effects, such as that may cause some nausea, or they might have headache, they might have fever. They also could have body aches. It may be even chills. Usually those last for only 24, no longer than 48 hours. But the benefit of the protection that the vaccine would give you from getting serious illness far outweighs any of those side effects.
So how about somebody who's got underlying arthritis? They're kind of achy all the time. Should they be more nervous about getting this vaccine, or should they remember that at least they're not going to get COVID?
Yeah, I think the latter. Remember why we're getting this vaccine, and that is to prevent us from getting serious illness, hospitalization, and, God forbid, death from a COVID-19 infection. So again, speak with your physician, but again, the side effects, these vaccines are so good in terms of protecting against disease, and even death, hospitalization, and serious illness. So that far outweighs some of the side effects that have been reported. But someone who has underlying condition like rheumatoid arthritis, and let's say if they have more aches in their right arm, well, maybe they want to get the injection in their left arm. You try to minimize the discomfort that occurs from a vaccination. But these vaccines are very safe, and we're very fortunate to have the 3 different vaccines that are available now under emergency utilization.
Now, I've been asked a few times by people who have some kind of autoimmune disease, whether it's rheumatoid arthritis or lupus or multiple sclerosis, any evidence or even transplant of some sort, any evidence that this vaccine might trigger an autoimmune disease or rejection, anything like that?
Not really, Meg. Obviously, we still are following, the companies are still following in post licensure trials, or I shouldn't say trials, post licensure studies. They are following up on patients to make sure that does not happen. But to date, it does not appear that. And even, I should stress, in the clinical trials prior to these vaccines being approved, there were patients who had rheumatoid arthritis and lupus and other autoimmune conditions. They were in trials. They were not. They were excluded if they were on immunosuppressive drugs or steroids. But if they were not on those, they were in the trials, and they tolerated the vaccinations very well. And to date, there's no evidence that says that they're far worse from having had the vaccine, in spite of having the underlying condition to begin with.
Fantastic. I think that's really comforting to know. And I know that you've seen all those studies in your role in the advisory committee of immunization practices. Now, right now we have 3 vaccines that are authorized for use. What do you think? Is one better than the other? How should we decide which one to get?
So that's a great question. We're fortunate in this country to have 3 excellent vaccines. And how I look at it is, how effective are they at preventing serious illness, preventing hospitalization, and ultimately preventing death? And those 3 vaccines are excellent. The J&J Johnson & Johnson vaccine appears to be 85% effective in preventing serious illness, death, and hospitalizations, whereas the Pfizer and the Moderna are greater than 90%. So all 3 of these vaccines are superb. And get which vaccine you can get is my advice at this point. Get vaccinated to protect yourself.
So sort of like we tell the kindergartners, you get what you get and don't get upset.
That's right. I like that. That brings back memories. Okay.
So there's been certainly a fair amount of hesitancy among a variety of people, including even healthcare providers, about should I get this vaccine right now, or should I wait a little bit and see what happens to my colleagues? What do you say to people to kind of help them through that hesitancy?
Mm-hmm. So first, I really want to make sure that they understand about the vaccine and how it was prepared. These vaccines were tested again and again. The methods that were used to make the vaccines, those methods have actually been around for 10 years or so. It's just that that particular method was used in developing and those are the messenger RNA vaccines. You'll hear that term used, and that's for both the Pfizer and Moderna. The other, the J&J, is what they call an adenovirus vector vaccine. But these vaccines are inert. They're proteins. They're not live virus vaccines. So, and they were tested fully. Thousands of people served in the clinical trials. And again, they were monitored very closely. So as far as we know, these vaccines are well tolerated. They're very effective. And I would, not hesitate to recommend any of them.
Excellent.
And not to be afraid. I think people need to ask their questions. They need to go to their primary care, ask their questions, and feel comfortable. But please, you want to protect yourself, because as we know, we're still not out of the woods yet here in this country. And as we see what's going on in Europe, they're having another phase again. So we want to stay protected. And the more of us who are vaccinated, the better off we'll be.
I couldn't agree with you more. Can you just say a couple words about how you think these variants fit in, and should that make us even more careful about getting vaccinated as soon as we can?
Absolutely, Meg. As you know, there are at least 3 different variants. There probably are more. And what we're hearing is, particularly in Europe, that these variants are becoming more common. We know that the variants do exist in this country, although in very small numbers. But the more people we get vaccinated, again, the better off we'll be. We don't want this virus to continue circulating, because that's exactly what happens. The virus begins to change in little ways. And before you know it, we're going to start having our own variants, or we're going to see more of the variant from UK, from South Africa, and Brazil is the other place where they're really starting to see different variants, and one variant starting to increase, and eventually it's going to predominate. So the one way we can at least slow that process of seeing variants is for everybody to get vaccinated.
Yeah, I agree with you 100%. And even in the United States, we're starting to see the New York variant, the California variant. I'm sure there'll be the New Jersey variant.
Yeah, absolutely.
It won't be far behind.
Absolutely.
One additional thing, the Centers for Disease Control and Prevention just came out with kind of new rules for people who've been fully vaccinated. Can you tell us a little about that, and whether that should be an incentive for people over 65 to get the vaccine?
Well, absolutely. And I think for anybody who has heard that and saw the wonderful pictures of grandparents being reunited with their grandchildren after a whole year of being quarantined, I think would want to make anyone go out and be vaccinated. So the CDC is saying if within indoors, or in a private place, if everybody has been vaccinated who is eligible for the vaccine, and anybody who's unvaccinated, as long as they don't have risk factors of becoming infected with COVID-19, that is okay, and even without mask. However, if you're outdoors, if you're in a public place, if you're among people outside your household, outside your family, or people from more than one household, that indeed you continue to wear the mask and practice social distancing as before. Good hand washing and all the things that we've used so far that has really helped control the virus to date. But vaccination is really helping us along here. So in spite, and I'm delighted to hear the new recommendations from CDC, but again, we have to be careful.
Yeah, I think, it's wonderful to think that maybe there's some light at the end of the tunnel and that we're going to get back to being able to hug our friends and really, really get a big kiss from that grandchild and give one back.
Absolutely.
All
Absolutely.
those things are really good news.
Absolutely.
With all that good news, though, at least for right now, as of March 2021, we're still not supposed to be traveling. So
exactly.
So I think that you hope that those people that you want to get close with, hopefully they're in your area, they're already in your sphere, but we're not yet ready to say, go ahead and grab a plane and go somewhere else. But
absolutely, Meg.
As more and more of us get vaccinated, maybe that will be in the future as well.
I hope so. And like you say, be positive, light at the end of the tunnel, but get vaccinated.
Okay. Now, is there anything else that we need to know after we get vaccinated? I think you touched on it. After we get vaccinated, we still need to do those public health things.
Wear your mask, good hand washing. If you're sick, stay home, don't go out. All the things that we have been doing, the social distancing, and just trying to be well. Just hang in there, everybody, because we want to go back to normal, so-called normal. But it takes everybody to participate. So people who are eligible to be vaccinated, they need to get vaccinated. And then even, as you say, after being vaccinated, we still need to observe those public health measures that have really helped us. The mask, right? Hand washing, social distancing.
Thanks, Pat. I really appreciate your joining me today, and I've really enjoyed our discussion.
Yeah, same here, Meg. You're one of my favorite people. Thank you for having me.
It's been a pleasure. So if you want to learn more about COVID-19 vaccine in New Jersey, visit covid19.nj.gov/vaccine or our vaccine support line at call 1-855-568-0545. We also always end these podcasts by reminding people that we need to stay vigilant. We need to continue to physically distance, wear the masks, wash our hands, keep surfaces clean, and please, if you're sick, stay home and, be thoughtful. And as soon as you're eligible, go ahead and get that vaccine. Right. So thank you for watching and stay safe, New Jersey.